Welcome to the deep dive. This is where we take that stack of reports, press releases, all that source material, and really boil it down to what you need to know.
Yeah, getting straight to the essentials.
Today, we're doing a deep dive into global humanitarian efforts. We're looking at how aid seems to be shifting, moving, beyond just temporary relief towards something more like long-term recovery.
Exactly. And our sources today, they really cluster around September 21st, that's the UN's International Day of Peace, and some, well, pretty comprehensive support projects from KOICA.
KOICA, right, the Korean International Cooperation Agency.
That's the one. They're working in some tough spots, conflict zones, places facing real hardship, and the focus is moving past just immediate needs like food towards really rebuilding lives, sustainable rebuilding.
Okay, so that's the mission brief then. Let's explore this shift. We've got two main project areas lined up that seem to show this whole spectrum.
Right.
First, support for Afghan refugees and their host communities over in Pakistan.
And second,
Some really critical rehabilitation services, physical and psychological, happening in Palestine right now.
okay, so it's not just about, say, building a clinic. It's about the tools for people to become self-sufficient again. That seems to be the core idea here.
Yeah, that's the thread we're pulling on. All right, let's start in Pakistan. We're focusing on Afghan refugee settlements, primarily in the Khyber Pakhtunkhwa province. And you can't get more basic than clean water, right? But how KOICA approached this, well, it really signals that philosophical shift you mentioned.
It really does. There's this story in the sources about a man named Sami Ullah and his family.
Right.
They're in the Dargai refugee camp.
Okay.
And the lack of clean water was just this massive burden. His daughters, they were spending hours every single day walking, just fetching water, long distances.
Hours out of their day. That means no time for school, safety risks.
Exactly. Sacrificing education, potentially their safety. So the aid agencies initially thought, okay, big problem, big solution.
Right, the typical approach.
Yeah.
Build something huge.
Pretty much. The original plan was for two massive centralized water reservoirs. But, and this is the key part, they actually listened to the people living there.
Ah, a crucial step.
A huge step. They partnered up with the UNHCR, the UN Refugee Agency, and basically they adapted the plan. They didn't stick to the original top-down blueprint.
So what did they do instead?
Oh, it's fascinating, the flexibility. Instead of those two giant reservoirs, they identified 14 local water sources. They installed purification and storage systems right there at 8 different sites. Much smaller distributed systems.
Closer to where people actually live,
Yes.
based on community input.
Precisely. It's a shift from we know best to let's design this with you based on your needs.
And the impact, is it noticeable?
Oh, absolutely. And immediate. For Sami Ullah's family, his daughters now actually have time to study. That's life-changing. Plus, neighbors are starting small gardens, things like that. It brings back a sense of normalcy, of dignity.
Water access restoring daily life.
Hmm.
Okay, so what about the bigger picture? The infrastructure, the institutions, health must be a huge concern.
It's critical. And importantly, these health upgrades benefit everyone, the host communities too, not just the refugees. That helps build stability.
Right, shared resources.
KOICA went in and installed essential medical gear, plus solar power systems, which is great for reliability, in 16 public healthcare institutions. That's across both Khyber Pakhtunkhwa and Balochistan provinces.
16 institutions, that's quite a reach. What kind of equipment are we talking about? Anything specific that highlights the impact?
Definitely. For severe cases, think about serious respiratory conditions. At the Balochistan Institute of Nephrurology in Quetta, they installed an oxygen generator.
Wow, okay. That's high-level stuff.
It is. It directly improves survival and recovery rates for the most critical patients. But it wasn't just about acute care. They also focused heavily on maternal and child health.
Which, as you said, is often so fragile in these situations.
Exactly right. So they renovated facilities, brought in new equipment. We're talking proper 24-hour delivery rooms, even emergency ambulances for 6 maternal and child health centers right in the camps.
So both high-level and foundational care. What's the scale of impact? Do we have numbers?
Yeah, the sources give some figures for 2024. Around 140,000 refugee patients got primary medical care through these efforts. And something like 150,000 people were screened for tuberculosis with UNHCR support.
Huge numbers. That's mass impact, but delivered through these specific targeted upgrades.
That's the idea, building a resilient health foundation.
Okay, health foundation covered. Let's pivot to education and social inclusion, because long-term stability isn't just about health. It's about opportunity, especially for women and girls, preventing dropouts, early marriage. I saw something about supporting girls' schooling.
Yes, and this tackles a really practical problem. How do you keep girls in school, especially middle school, when just getting there might be difficult or unsafe? This is key to stopping that cycle of dropping out, which can lead to early marriage.
So what's the intervention?
It's actually quite straightforward but makes a massive difference, providing transportation fees.
Ah, simple but effective.
For about 3,000 female refugee students in middle school. It just removes that physical barrier, keeps them in education, which broadens their horizons, gives them more choices.
Delays early marriage, increases participation. Makes sense. What about kids who can't get to a physical school? Or bridging the digital divide?
Good question. They've thought about that too. They've rolled out home-based alternative learning programs, plus training for teachers on using both online and offline methods effectively.
Okay.
And they've given students tablet PCs. So it's like digital education they can access from home, but still supported.
Supported by, how does that connection work on the ground?
Through community volunteers, they've set up this system where volunteers act as a bridge, basically, between the refugee community and the UNHCR.
So real people connecting the aid to the need.
Exactly. It means needs get identified faster, problems get solved quicker. It's aid that's actually connected to the community, not just dropped in from outside.
Aid with eyes and ears on the ground.
You got it.
And just to round this out, the sources also mention specific programs working with NGOs to support really vulnerable groups like sexual minorities, people with disabilities, and developing ways to respond to sexual violence too.
Right. It's aiming for a truly holistic approach.
It really paints a picture of what comprehensive support looks like. Safety, health, education, dignity, all interwoven.
Okay, so if Pakistan was about building that systemic stability, that self-sufficiency, our next focus, Palestine, seems to zero in on recovery from trauma. Really complex recovery, physical, cognitive, psychological.
Yes, the invisible wounds of conflict alongside the visible ones. And the story of Ahmad Abed, it just brings the importance of this into sharp focus.
Tell us about Ahmad.
He's just 19 from Kabatia. About a year and a half ago during an Israeli airstrike, rocket fragments hit his head, caused a severe traumatic brain injury, a TBI.
Oh, wow. 19.
Yeah. 22 days in a coma. When he woke up, his left side was paralyzed, he was blind in his right eye. Needed help with absolutely everything, eating, washing, dressing. It's devastating. You hear about conflict, but these are the individual human stories behind it. That kind of injury isolates you completely.
Totally. Physically, emotionally,
Yeah.
it traps you. But then he started at the new Rehabilitation Center in Kabatia.
Okay, one of the centers Koica helped set up.
That's right. And his recovery, well, it's pretty remarkable according to the report. Physical therapy first. Within 3 weeks, his walking improved significantly. He could even manage stairs on his own.
That quickly. Amazing.
Then occupational therapy. 4 weeks of that. And he regained independence in daily activities. Eating, bathing, dressing himself. Basic things we take for granted.
Huge steps towards regaining his life. But you said it was more than just physical.
Yes, and this is crucial. This is where it goes beyond just, say, physiotherapy. His memory started improving, his cognitive function. He reached a point where he could actually plan his own daily schedule again, think independently. And critically, he received psychological therapy. To deal with the intense anxiety, the social isolation that comes with that kind of trauma, the changes to his appearance, it helped him regain confidence.
And the outcome.
He's back at work now.
Incredible. That's not just helping someone survive. That's literally giving a 19-year-old his future back.
It really is. It highlights why integrated rehabilitation is so vital after conflict injuries.
So tell us more about these centers, the project itself, and maybe the technology. Because using advanced tech in humanitarian settings feels like, well, like the next frontier.
It really does seem to be heading that way. This is all part of a KOICA project called Establishment and Capacity Building of Public Rehabilitation Centers in the West Bank of Palestine. They've been working on it since 2021, partnering with the WHO, the World Health Organization.
Okay.
And just this year, back in April, they opened 2 new centers. They basically remodeled parts of existing public hospitals in Ramallah and Kabatia.
And inside, what kind of services, what kind of tech?
Well, it's comprehensive. You got occupational therapy, physical therapy, speech therapy rooms, and dedicated mental health counseling spaces. Integrated care under one roof.
Right.
But the tech is where it gets really interesting. They've brought in state-of-the-art equipment, things like VR systems, virtual reality for walking,
Yeah.
and balance training.
VR for balance in a rehab center in the West Bank.
Yeah. And also these 3D interactive devices specifically designed for cognitive rehabilitation,
Yeah.
helping retrain the brain after injury.
That's fascinating. It's moving way beyond just traditional physio. It's targeting the brain, the mind, body all at once.
Exactly. Integrated treatment using cutting-edge tools.
So is this kind of high-tech, high-investment approach sustainable, or is it just a temporary fix?
The goal seems to be foundational. Look, residents in the West Bank have been living through intense conflict for nearly 2 years now. Access to this kind of professional integrated rehabilitation supported by Korea, it's not a luxury, it's essential for long-term recovery, especially for complex injuries like TBI.
Okay, so it's seen as a core part of building back. And I assume this connects to a broader peace strategy. It can't just be about fixing injuries in isolation.
Absolutely. It's framed as part of comprehensive support to help overcome conflict, instability, poor living conditions. KOICA is also working with UNICEF, for instance, on improving schools, kindergartens, primary, secondary in those same conflict-affected areas.
Education again.
Right. And partnering with a Palestinian NGO called SAWA to make sure psychological counseling is available more broadly to residents impacted by the fighting. It's a multi-pronged approach.
A layer upon layer of support.
Exactly. Resilience building. Kim Min-jong, who heads the KOICA office there, put it quite well. He stressed their commitment is to long-term projects. Projects aimed at overcoming conflict, promoting peace, and recovery.
Recovery being the key word there. It really ties everything together. Hashtag outro.
So yeah, when you look at everything together, the pattern that emerges from these sources, Pakistan, Palestine, is that humanitarian aid is definitely evolving. It's moving past just keeping people alive day to day.
Right. Survival is the baseline, but not the end goal anymore.
Precisely. The real focus now seems to be on comprehensive recovery, rebuilding societies. So that means fixing the basics, like clean water in Pakistan or improving education access. But it also means tackling those deeper, often invisible wounds.
The psychological trauma from conflict, the cognitive recovery needed after a brain injury, like Ahmad's case.
Exactly. And what really struck me was the flexibility and the responsiveness of these projects.
Yeah, me too. In Pakistan, you see them ditching the big blueprint for smaller water systems because the community needed it differently. Tactical flexibility.
And then in Palestine, you see this embrace of really advanced technology, VR, 3D cognitive tools being deployed right there in a conflict zone for rehabilitation. Technological depth.
And it feels like aid is getting smarter, maybe because it's listening better and adopting technology faster.
I think that's a big part of it. Which kind of leads to a final question, something for you, the listener, to think about. Well, if advanced technology like VR for balance or these 3D cognitive devices are now becoming part of essential humanitarian support in places like Palestine, how might that change our whole definition of essential aid in the future? When we face the next global crisis or conflict, will things like cognitive healing and mental health support be seen as just as fundamental, just as critical as food, water, and shelter?
Right. Is the definition of basic needs expanding to include mental and cognitive recovery? That's definitely something to mull over.